Hi, and welcome to Nursing 259, Week 7, which is a continuation of our teaching and learning that we began in Week 6. This week we'll be talking a little bit about how to move beyond what we began our conversation with in Week 6, looking specifically on how to develop a patient-focused teaching learning plan and anticipating potential barriers that you may experience in your teaching learning plan, especially when you get into the clinical setting, and utilizing some techniques, ways to tell whether your patient had the intended outcomes that we wanted. There's 3 chapters in this week's reading list for Falvo in chapter 2, 4, and 5. And we're going to begin this week's audio lecture by talking a little bit about patient and family-centered teaching. So there's a concept of patient experience that I began to talk about in class last week, specifically about the whole notion that it isn't simply enough to get rid of someone's infection. We want to make sure that the patient is cared for holistically and that they're provided with an experience that improves their well-being. And we talked a little bit in class about how that involves the patient's environment, whether it's clean, warm, feels safe, whether they feel engaged with the staff and the physicians, whether they receive the education that they feel valued. All of those things go into that patient experience. And that's part of what the patient surveys will be representing. When the patients receive those surveys, they'll send those in and give ratings to how well they did. And we'll talk a little bit about what those surveys look like in class, but we'll just kind of touch on that concept for now. But so that you understand, advocacy, that means speaking up for your patient, promoting their health, that really begins with having a conversation with the patient and their family, significant others, caregivers. And the context of the patient care is always from the viewpoint of the patient. So if you keep that in mind, it's like, what does the patient need? What do they want? What can I do that fits where they want to go? That'll give you a lot of guidance of what to do with your teaching learning plans. So why do we focus on the patient and their family? First and foremost is just respect for patients' values, their preferences, and expressed needs. We want to look at coordination and integration of care, and if we focus on the patient, we're likely to end up where we intended. Information, communication, and education is very key. Physical comfort. If we're talking to the patient and asking them if they're comfortable, again, it's not what we think will make them comfortable. It's what they want to feel comfortable. For emotional support and alleviation of fear and anxiety, we want to make sure that we're involving the family and friends, and also recognizing part of that advocacy that maybe the involvement of the family or friends increases anxiety or stress for the patient, and maybe our job to advocate is to protect them from that. So that involves having a conversation with your patient and asking them how they feel about visitors. And also for transition and continuity of care. We also need to be aware of some of the potential barriers to learning. So there's many things that can keep our patients from learning. One of the things is our cultural, where they stand culturally, and that's usually a difference between what their cultural values are versus ours. And so having acceptance, familial and societal expectations, and this culture can be a heritage, but it can also be gender roles, societal roles, and age-related roles. So keeping those in mind. Linguistic barriers can be a problem. Those are some of the most obvious, whether they can speak the language that we have, but it can be something with expressive and receptive aphasia, maybe somebody who had a stroke. Maybe they don't read or write very well. And again, those are things that we talked about last week. The learning style and preferences, especially that VARC that we talked about, the visual, auditory, read, write, and kinesthetic learning styles. Sensorial, the hearing, vision, tasting, smelling, feeling, all of those things contribute to whether the patient can understand us. And also their cognition. Are they alert? Are they oriented to their surroundings? Do they understand their situation? Is their cognition affected by their medications or their treatment? Are they stressed or worried? Again, the reading and writing literacy, but don't forget about healthcare literacy as well. We talked a little bit about the language of medical terminology, which is often confusing for our patients. Psychological, fear, apprehension, anger. Maybe they're disgusted with themselves. Maybe they're embarrassed. Maybe they're disappointed. Maybe they feel like they're being judged. And maybe some bias about what they believed. Maybe a bias in the fact that if you're a male nurse, maybe you're a female in a maternity unit and may not feel comfortable having a male nurse. Physiological, disease, age, especially children, the very young and the very old, side effects of medication, hunger, elimination, nausea, pain, some external stressors, financial burdens, interpersonal relationships, and then an environment. Those are simply just the noise, temperature of the room, some distractions going on around them. Others in the room, most of the rooms are private now, but not all of them, and maybe the lighting. And then finally, I want you to consider the fact that maybe you might be a potential barrier. So when we think about, we don't always like to think, we like to think that we're very helpful, but sometimes we're our own worst enemies. So we talked a little bit about being present in the moment, being with your patient, and your patient should feel special, like they're your only concern. Of course, they know you have other patients, but while you're there with them, they should only feel like you're responsible for them. And they shouldn't be aware of your distractions, either personal or professional. So, interpersonal communication skills, again, we're talking about the therapeutic, empathic, and sincerity. Maybe you have deficits in knowledge. You're new. Maybe you don't have all the information, and I think honesty is the best policy in this. If you want to build trust, don't try to wing it. If they have a question, you say, you know what, that's a great question. I'm going to go find the answer for you, and make them feel like they can at least trust what you say. It's okay if you don't know it's not okay to not know and share the information anyway, or give opinion. And maybe you're culturally unaware. Your cultural competency with that specific heritage or age grouping. I wasn't around a lot of elderly people growing up. My last grandparent died when I was 9, so I didn't have a lot of exposure to elderly people. That was something that I had to kind of feel my way around once I got into nursing. So this is just something to think about. And we talked a little bit about what culture is. It may not be heritage, it may be traditions or customs, maybe language, ethnicity, or race. Technology is a very interesting thing because we know that generationally, people that are a little bit older tend to have a little bit more trouble with technology. I talk about foods, so maybe there's some dietary things that may be helpful to your patients, and also their history. What brings them to this community? What ties them to their culture? So being culturally aware, one of the things you want to ask yourself is what do our culturally diverse patients want from us? And I think the easiest way to do is just to ask them. Just say, what do you value as I'm taking care of you? It's a very simple question. We just forget sometimes to ask. Asking them how they view healthcare. Who's important to you to be involved in your healthcare? What are your goals? It's probably not the same as yours, and I think being open to that is the best way to approach your patient's care. So, some of the talking about in Falvo, you'll see these in there. Characteristics of effective learning, making sure that you're including your patients, involving them and their care providers, in their decision making, listening to your patients, being present, not assuming that they want the same thing as you do, being realistic in the goals that you set. And these should be shared goals, so the patient should be guiding you there, but these should be goals that are mutually achievable. Be precise in measuring your outcomes. So if you say that they're going to ambulate today, how far do you want them to go? How often do you want them to ambulate? These are all things that should be in there. It should look like a recipe so that anyone else coming in to follow your plan would be able to support what it is that you wrote. And evaluating and refining the plan if needed, being open to that. Always be vigilant, looking for ways to improve your plan. It probably isn't going to look perfect when you first roll it out, but it's a work in progress, and the goal is to get it started with the best bearings and using the patient and other interdisciplinary healthcare personnel, getting the plan refined until it's as good as it can get. Also considering the interdisciplinary approaches, again, we want to make sure that we're including, when you go to your long-term care facility, you're often going to be using occupational and physical therapy and maybe speech therapy as well. Working with the strengths of the patient and their preferences, keeping in mind that's what being patient-focused is about. Giving them encouragement, telling them that this is something we can do together and that you're there to support them and help them. Celebrating even the small successes. This is so important. We talked a little bit about even if they can move toward better health, that this is a positive win and we want to make sure that they feel good about that. And being careful not to judge your patient for not being able to achieve the goal, because remember, these are their goals and we need to help support them get where they want to get to, not necessarily where we think they should be. So I look forward to seeing you in class this week, and have a great week.